I'm Paul Nagy. I'm an associate professor of radiology at Johns Hopkins University.
I'm Jeff Jensen. I'm a third-year radiology resident at the Johns Hopkins School of Medicine.
How do either of you see the information in the paper that you wrote being used right now by our readers? What are we supposed to think about it? What are we supposed to do about it?
I was very excited we found a lot of amazing examples about how quality improvement can have a dramatic effect on patient satisfaction. So if there's any complaints or grievances or any perception of poor patient experiences in your department, you should know, and we say many, many examples, that QI methods have had really dramatic effects on patient experience. And so I think that they should be looking at QI methods as a very effective way to try to improve the patient experience.
Even though we couldn't find a really strong link between outcomes and patient satisfaction, I think that if anyone's been to the hospital, or that it's important for us to relay the message to physicians, or to help our fellow physicians understand that despite the unclear correlation, that patient satisfaction is still a really important part of the entire patient experience, and that we've all had family members and grandmothers and people who've been to the hospital, and regardless of what their outcome was, we want them to be comfortable and happy, and their providers to be attentive to their needs, and that their needs are more than just their physical condition. And I think that sometimes we forget that. And so I think that we tend to focus very strongly on the outcomes, and despite the uncertainty of whether each specific thing that we do has a direct measurable effect on outcomes, it's still really important for our patients to be comfortable. And so that's an important thing to focus on, despite the uncertain impact on incomes that those efforts have. And like Paul said, the quality improvement efforts are easily and demonstrably effective at improving patient satisfaction. I think it's an important thing to do, and we should start using quality improvement to improve patient satisfaction. We provided a lot of examples of how it was successful in our paper, some low-lying fruit that people could use and start improving their practices.
Jeff, I want the last word to be how you linked it back to the theme of the journal, which is patient and family-centered care, reminding us that patients have a multitude of needs, not just the care that we can render as physicians. So thank you for returning us back to our roots, so to speak.